Welcome to News and Brews, with information on surgical robotics, insights on medical devices and digital health. We turn to our MD&M West correspondent, Ann Wyatt.
All right. Well, welcome to another interview here at MD&M West. I'm super excited to be talking to Krystal Santiago today. She is with Planet Innovation, and we are going to have another really good, riveting interview. Krystal, hi. How are you?
Great. Thanks. It's nice to be here. It's a big show again this year. I can't believe how many booths there are. It's kind of crazy. You need to get your walking shoes on.
Oh, absolutely. No, I have mine in the back. Yeah, absolutely. It's a really good turnout this year, do you think?
Yeah, absolutely. I think so. I happened to be here in 2020, right before everybody shut down, and it was completely empty, right? Like every other booth was empty because people weren't traveling. And now it's completely full. It's kind of great.
Absolutely, yeah. This has been the busiest. I came last year. I think this has been the busiest. It was busier this year than last year, for sure. So, well, why don't you introduce yourself here and kind of give us a rundown on your own passion and why you're passionate about working for Planet Innovation?
Sure. So I'm actually an engineer by training, and I worked my way up through the quality organization, and I switched over to regulatory at some point, and it turns out if you're good at engineering and you're good at writing, that's kind of where you're supposed to be because you can translate. I've done just a tremendous amount of very, very cool products, and actually product development has become my passion because the new things that we bring to the market that people haven't even actually thought of before are really remarkable. And Planet Innovation is kind of a cool place to work because we actually work on cutting edge technology and we develop it for companies that aren't developing it for themselves. So we actually get to see things that nobody else gets to do. And we don't get to tell everybody that we do the things, but it's still very cool to see the next generation of med tech that's coming out.
Yeah, and what do you like the most about product development? Because I would think that would be a really riveting space to be in because I would assume that there would be so much innovation and creativity. And as kind of a creative individual myself, that would be right up my alley, right? I want to innovate. I want to be the one that thinks of the ideas and then makes them happen, right? Is that kind of in line with how you feel as well?
No, so kind of, right? So I don't actually design the products, right? But the part that I really like about new innovation is that I get to challenge, right? So you bring a new product to market. One of the biggest things you have to do is fight with the regulators about how it's going to come to market. And that's actually really fun for me. I used to call it playing chess with the FDA, and I'm really hoping nobody from the FDA is listening right now. But it's about how you position things and how you decide where you're going to take risk and where you don't want to take risk and the package that you put forward. And I used to get an incredible high, it sounds super nerdy, when I would get something through the FDA with just a couple of questions because then you knew you pushed the boundaries. But if you didn't get any questions, you didn't do your job, right?
So you're like the medical device mentalist.
Kind of. I
Love
like
this.
that.
You don't.
I I like
I think
that.
it's fantastic. That's your new hashtag.
I'm going to use it. I'm going to start a YouTube channel and use that.
Absolutely. So very cool. Yeah. Well, tell us a little bit more about some of the trends maybe that you're seeing in the medical device industry this year, and kind of where you're hoping some of those trends evolve. Like, you've seen the trends. What are you hoping to manifest from that?
So it's actually kind of cool. So most of the things that I worked on a lot of class 3 implantable devices. I spent probably the last 6 years of my career in heart failure devices, which is completely an unproven space, right? You see lots of heart valves. Heart valves are actually a treatment for heart failure, but there's lots of different ways that they can treat for that. And so that space is really interesting because you would go to the conferences, it'd be really, really depressing because they'd say the only thing we have is we put them on a pacemaker. That's it. Or we change their drugs and we hope that we relieve some of their congestion with diuretics. But there's a whole new generation of devices. Actually, one of the devices that I worked on a long time ago, about 6 years ago, just got approved by the FDA for a tricuspid position. And it's very cool to see that technology finally make it to market and be able to impact people's lives.
Yeah, I mean, absolutely. I come from a very long line of hereditary issues with heart problems and heart disease. And my father had 2 heart attacks and had a pacemaker. My mother, she had congestive heart failure herself, and it was always very scary, and there was always such a strict routine, right? There was always the Lasix and the and the cholesterol medications, right? And all of that stuff. And if we can come up with better products or better solutions that drive patient care to where they're less dependent on that drug routine, right? That cycle of just in and out of the drugstore every month, right? So, if there's some way that we can do that, I mean, that would be amazing, being in those shoes.
And actually, there's a lot of not necessarily wearables, because they're now starting to implant sensors, but some of that stuff's actually really quite cool, because it basically means there's physiological symptoms before you start feeling bad, right? So you can actually see a change in the amount of water weight you're holding in your bloodstream before it actually shows up in your body. And so there's ways now that you can actually monitor that, and your doctor can see it real time, so that they can hopefully help you out instead of you just experiencing it at home.
I mean, that's really the power of data, right? And I know that we're all on this big Industry 4.0 kick right now, right? We're talking about data and data collection and what data is valuable and how do we use the data and all of this. But I would like to see more applications and like a well-roundedness, because mostly we think of that and we think about machinery, right? We're thinking about the robots and how the data is coming in and being translated to, OT to IT, whatever. And but I am really more passionate about how do we use data individually for our own health.
So I think that's a really interesting topic, and actually the FDA has a ton of thoughts of it at the moment, because there's so many software as a medical device or wearables that are coming to the market that want different indications, like my Apple Watch that has an indication for AFib. So I think that the data is powerful, but I also think too much data is also too much for the average person as well. So you have to find the balance of the things that you want to know about rather than the ones just because they're available. Like, you can track 5 million things on your Apple Watch or on your health app in Apple, and you can connect all of the things, but it doesn't mean that you're making better decisions. It just means that you have evidence of the things that you weren't doing anyways, right? So you have to decide what matters to you in order to make it work.
Absolutely. Well, Krystal, I really appreciate your time today. I believe that we are ready to wrap up this segment, but I appreciate that. Do you have any closing thoughts for us today?
No, I think medtech right now is actually really exciting, because I think that there's a next generation of a lot of different platforms that are coming out that makes medicine more achievable, that makes it very easy for the average person to get access to it, and it doesn't require as many centers of excellence as it did before. So it's really driving some of the stuff into the hands of the people that need it without creating barriers for it. And I think that that's what the next evolution of medtech is, and it's very cool to be a part of that.
I love that. I love that you're so passionate about it. So thank you so much, Krystal, for coming on today and sharing that passion with our listeners. It's very inspiring, and we appreciate it.
Thanks, Ann. It was great being here with you.
Awesome. Well, perfect. Well, live from News and Brews, this is Ann Wyatt signing off.